So welcome to the webinar today. My name is Sheldon Collins. The webinar today is on auto-injecting. We're going to be talking about the MedInject and also exosomes. And I'm going to give a little bit of an overview first on private practice solutions. If you're not familiar with our company, you might have heard of it, called PPS Lasers. We are the nationwide distributor of the MedInject, the device we're talking to today. We also distribute biological products, exosomes and stem cells. We were founded in 2012. We work with aesthetic providers nationwide. We have consultants who represent our products in many states. And aside from the auto-injector, we sell a portfolio of devices commonly used by aesthetic providers, which may be viewed on our online shop, ppslasers.com. So if you like what you heard today, please reach out to the person who invited you on this webinar or contact us directly at info@ppslasers.com, and we'll connect with somebody will connect with you, or we'll connect you with a PPS consultant in your area. On the agenda today, I'm going to introduce our keynote speaker. We're going to do a live demonstration with the MedInject. Our speaker is going to show you today how she uses the MedInject at her clinic combined with exosomes. So a very exciting presentation, a very hot subject on the marketplace right now. Afterwards, we'll have times for some clinical Q&A on that. And we will also go over some of the pricing as well as a bonus offer that we're offering for attendees on the webinar today. I know some people will be listening to the recorded version of this, so that bonus will be extended to you as well if you happen to see it on the recorded version. So a little bit of background on our speaker. Our speaker's name is Gigi. She's a master trainer. She's a clinician with 20 plus years industry experience. She has manufacturing training experience with over 120 aesthetic devices. She owns and runs 2 med spas of her own in California and Texas, and she has her own training and consulting company.
As Sheldon said, I've been an aesthetic provider for quite some time, kind of a dinosaur in the industry. And so the good thing about being a dinosaur is you've watched it evolve, the industry evolve. And it's so exciting because, every couple months there's something new, or we expand on a new arena of things that, just up the ante on our practices. What we're going to be doing today is talking about how I use biologics in my practice. And we're going to be talking about the Neoderm X that I do use frequently to enhance hair restoration. So I'll use it for hair restoration. I'll use it for post-procedure. If I'm doing a resurfacing procedure, I will do that just to make sure that the healing process is actually the time that the downtime from such a procedure is a little bit less, because we all know that with the growth factors from exosomes and the biologics, that it induces neocollagenesis. And I do use PRP in my practice, but I tend to now go towards the exosomes, because if we're looking at PRP, depending on the age, of course, when we're young, it's fabulous, it's fantastic because we have these great growth factors. But as we age, they don't function the same way. So, max growth factor from PRP might be 25 growth factors. We're using a biologic, we're getting up to 425. So it's kind of like, no offense, the Toyota to the Ferrari. So for me, it has really excelled our results. We use it under eyes, for people who are not candidates for under eye filler. And to help with these, fine lines. So it's a little difficult that we don't want filler to be so obvious. I use it and I mix it with different things too. I will do a biostimulator, such as Sculptra, and then I will put that on top of it, and it kind of sets it on fire, and I even get a better result, which we'll be talking about on our next webinar, is about doing, Sculptra with the MedInject as well. So there's, million different ways that you can add this to your practice and really up the ante on your results, and not have the, with the same amount as you're charging for PRP. We don't have to do a blood draw. We don't have to buy kits. We don't have to do any of this. We're just straight from the bottle. And, that's time, and time we know is money. So I'm going to come over here to my lovely model, and we're going to go ahead and get started. I'm going to show you a live demo of how this works. So here I have all my settings: what size syringe, the size, the area that I'm doing, the type of skin that I'm doing, how much solution that I have in. And this, of course, is the speed that I'm going to be injecting the product. And then how viscous my product is usually how I set that. And so we're going to get started on that. And I usually turn the patient towards, me, so that they can go ahead, or turn them the way that it's more comfortable for them and more effective for me. So here we go, me. How's that feel, me? Yeah, and so when I'm doing a biostimulator, I like to keep it, in the range of 0.8 to 1.25 epidermally, because if you're wanting to with hyperpigmentation, we know all the melanocytes, keratinocytes, and what have you are all epidermally. So that's where I'll focus. But I do go dermal junction too, if I want to induce, more neocollagenesis, because we know at the dermal junction, that's a sweet spot. So surely you can put it to any depth that you're trying to affect. And
Gigi, maybe you could comment a little bit on what you've seen in terms of the results at your clinic between using PRP versus exosomes.
I do see better results, I will say, especially in the hair restoration area, than I do with PRP. And it makes sense, because we're looking at growth factors of, up to 425 versus 25 max. So it makes all the sense in the world. But I do see faster healing times and fabulous results with my CO2s. So any resurfacing, CO2s, erbium, any of that, I'm seeing increased results than I had before. So it's just kind of like a little recipe that I like to put together, because it ups the ante in the results. And I mean, resurfacing is always fabulous, but it's kind of like the icing on the cake for it. So I prefer all my CO2s to be followed up with this, and I do it immediately after, and you'll see it. So funny, because usually they're pretty red when I'm doing CO2, directly after. But the minute I do this, after it really calms it down. You can see it immediately. So it's going to work in the healing process. So my clients are really, really liking their results. And most of them are repeat clients, so they've seen the difference, and now they prefer having it done with the exosomes. So I'm a big fan favorite. Always,
right.
always a good result. It never, doesn't disappoint in that arena for sure. Does anyone have any questions?
Let me just check the chat here too, because I see that some people are trying to ask a question and it's getting a little bit blocked here. I think it's the Zoom. Yeah, here's one is in terms of how often you use this, just exosomes only, just auto injecting like this. Do you see this pretty common on a daily or weekly basis?
Yes, I do this on a single faceted treatment. So on its own, it is a standalone treatment. And I do that for people who I'd be doing also fanning PRP for who like that natural look. And I also too with the sculpture too. These are for people that want to just stay quite natural and let the body do it itself and induce its own neocollagenesis. That's when I will use this as a standalone, and people seem to really like the results. If you like your PRP results, you'll love that. You'll love this because it's kind of putting PRP on fire, if you will. And sometimes people do combine the both, so that's always something you can do as well. So yes, right. Definitely a standalone treatment.
And we did a previous webinar where you just did the exosomes topically after a MediRof treatment. But it sounds like you prefer at your clinic to actually combine it with auto-injecting versus topically, or, when do you decide to go topical versus auto-injecting?
So it makes sense that anytime you do something topical, it's great, but we all know that if I'm going to inject this at the precise depth, with the precise amount that I want, anything's going to be better if we're injecting it into the spot we want it, rather than just rubbing it on top and hoping that it's going to fall in. We know the inflammation process. So wherever we poked a hole, if we were doing microneedling, it's going to close at about, inflammatory process starts about 0.3 milliseconds. So by the time you hope something falls in that area that we poked a hole, probably not going to happen. You're probably going to get about 5, max 15% of that efficacy. Whether now I know I'm getting 100% because exactly where I'm putting it is where it's being injected. So there's no doubt of how much if I'm getting of, PRP harvest or my exosomes. I don't want to waste my exosomes. I want them to go precisely where I need it, and I want all of them to go there. So I prefer to inject them.
So for the customers who are used to using PRP as growth factors, you would be using exosomes. You're using exosomes in the same capacity, essentially. But for somebody who has not used PRP before, who are the target candidates just for a single faceted treatment like this? Is it just skin rejuvenation and skin texture in general, or is there specific patients?
Well, here's the thing is, one of my biostimulator reps did say this the other day, and I go, gosh, that's a perfect thing. It's not specific to, how old are you, or what's your skin type, or what you have or haven't done, or what ailed you, whether you had acne or you didn't, thin skin fixing. This is for everybody because everybody's skin is aging. That starts at about 20. We lose 1% of our collagen every year. So by the time you're in your 50s, you're about 35, 40% of the collagen rejuvenation that you had when you're 22 is gone. So why would I not want to do this? Just to keep in, just as a little boost, just as a little helper. We all need a little help. Nothing wrong with that. So I prefer doing exosomes, just to keep, my skin where it's at. It's
excellent.
It's a no-brainer.
Yeah. So on a weekly basis, how many times are you using the MedInject and doing exosome treatments? It's like 5 to 10, 10 to 20. Is it daily?
I would say sometimes we have 3, sometimes we have 2, sometimes we have 1, but we do use it frequently. I would say about, at least 10 per week.
Mm-hmm.
10 it's per week. All in how you market it. When you give people the science and when you tell them what's happening and you educate them, it makes all the sense in the world. And why would you not? If you explain that to people, because most people don't know how fast the rate, their collagen is degrading. I think at this point in my life, my degradation process of my cellular turnover is far greater than the replication process. So, there's a need for everybody it's not just, one age group. Everybody everybody can benefit from it. When I first got my hands on the MedInjecT, I was so excited about it because I knew what it was possible. And we studied with a doctor from Korea who helped develop it. And for me, he would think, we can do hyperdiluted Botox, we can do vitamin C, we can do glutathione, we can do PRP, exosomes, mixtures of PRP with hyperdiluted HAs. So it just went on and on. And then, combining that with the different devices that just, the ante on the results that you're getting, it's a no-brainer. So this is how I nicknamed this my Windex of my practice, because there isn't anything I don't have as far as a energy device that I cannot, that I don't combine this with. And I use it for standalones too. So it's a necessity, I think, in everybody's practice.
Right. So your injectable nurses are constantly using it every day, basically.
My injectable nurses are, and now that we know that we can do the biostimulators, the hyperdiluted biostimulators, they're ecstatic, because to know when people are now using so much Sculptra on body parts, over knees, thighs, neck, décolleté, face, they're using on, their arms, the crepiness. So now we know we can get it evenly distributed, in the perfect amount. Now everyone's just jumping on the train because the results that we're seeing are pretty incredible. Much
That's
more
awesome.
than if I was standing it through. It's really exciting.
Yeah.
Really exciting.
Now I'm going to flash over to the pricing, and maybe we can kind of join this with a little bit of the ROI stuff too. I just had the pricing screen up here, and I'm going to have you chime in a second just in terms of treatment ROI. But what I'm showing everybody here is that the device itself, if you're interested in the MedInjecT, sells for $22,875. If you attended the webinar, listened to the webinar recording, I know there was a big demand for this one, and I know a lot of people can't necessarily make it at this time but want the recording. You still get the discount. So special pricing today is the $21,875 plus shipping, tax, and training. Financing, if you've got good credit, doctor, you're looking around $550 a month for this device. Like Gigi was saying earlier, and maybe you can comment a little bit about this, Gigi, is that you find that on a monthly payment, if you're doing just one hair restoration treatment a month, that you're basically covering your costs of the actual device if you're financing it over 60 months.
Yeah, make sure payment. There's no way you can not pay for this. You pay for this. I think I paid for one. You can probably correct me on this, Sheldon, in it was like a month or two, just in what we were doing with everything. Because when you're thinking about, we're charging anywhere, depending on the area you're in, from $500 to $2,500 has been my highest. That's depending on what you're putting in it. It pays for itself quicker than any device probably most people have in their office.
I almost forgot to put the bonus up today. So if you are on the webinar today or caught it on recording, there's also a bonus that we're doing 0% financing on the device. So put 50% down. We're doing 0% financing on 12 payments thereafter. So you kind of see how the estimated payment on that works. So helps make it a lot more affordable in terms of, getting the device in. Once you get the device in, you get the training, and then it kind of opens up the training. And maybe you could talk a little bit about that, Gigi, in terms of your training, because there's just so much that goes along with this device. I mean, it's like there's so many different materials. And, what do you say to people that are like, okay, I already have experience as an injectable nurse, of course, but, auto injecting plus all these different things you can put into it. What does training kind of look like?
If we don't get to training, and they have full access to me all the time in case I leave training and they say, I want to try this, or I forgot that, or I did. You always have access to me, always.
Great.
You guys have my number and my email there, and I have no problem answering a call and helping you through whatever you need.
Yeah, and let me just flash that up on our last screen here. So this is the contact information. You have Gigi's Instagram is GMSAE Consulting. Our company is PPS Lasers. So anything, if you didn't catch everything today, I know the recording is going to go back out so you can see the whole thing. If you want to just go directly to the product page for the MedInjecT, you can go to theinject.com. Well, thank you very much for sharing that, doing the live demonstration at your clinic today, and we really appreciate it. And thanks, Maeve, back there too. She can't hear us, but
Thanks, Maeve.
she makes a great model.
Yeah, she does. Thank you so much for everyone joining us. Feel free to call me, email me, ggtrainer1@gmail.com, and I will help answer any questions you may have clinically. That's for sure.
Awesome. All right. Well, thank you everybody for joining. And then once again, there's our contact information. This will be available on recording. Take care and have a nice evening.
Thank you. Take care. Bye-bye.